Hey everyone, my name is Chihao Tsui and I'm the founder and CEO of MyOwn Communications. I'm a recent KFBS grad and a practicing orthopedic physician assistant. Really excited to be here on behalf of the entire MyOwn team to tell you about how we are working to improve the care delivery experience for our nation's healthcare providers. So the problem that we're trying to solve is that communication care collaboration between healthcare providers continues to be a frustrating and highly inefficient process. As a provider, it's still very challenging for me and my staff to be able to expedite an emergent medical problem. It's very challenging to be able to refer patients to other providers or ancillary services. A very relevant recent example of this is trying to get a patient in for a timely COVID vaccination or a COVID test. Finally, trying to send and receive key patient information, especially when that information is coming from an outside institution. Those transactions are still very challenging despite some of the purported innovation that we've seen in the healthcare space. And the crux of the problem is that there's currently no universal solutions or products that allow healthcare workers to find and collaborate with their colleagues in order to be able to expedite the care delivery process. So I want you all to imagine for a second that you're a healthcare worker. A patient walks into your office with a problem that you're not necessarily equipped to handle. For me, this always was happening on a Friday afternoon. A post-operative patient with a presumed blood clot might walk in. And as part of that process, it's my responsibility to be able to get that patient to the appropriate resource. The first step of that process is being able to identify that local resource and who was available. But the problem is that there's no standardized mechanism or search process that allows me to find available local resources. A lot of the solutions that do exist are not necessarily catered towards my needs and may not be able to provide me with the information that I need. So if you look here, I've queued up a lot of the search results that physicians commonly see. A lot of great information for patients, for scheduling appointments, but nothing necessarily that makes it easy for me to expedite that referral. So assuming that you are able to find someone that's available, that's able to see that patient, the next process involves actually connecting with that patient, and that process is just as challenging. It's estimated that healthcare workers spend 46 minutes of each day just trying to communicate with their colleagues. And again, the problem is that there's no universal solution that allows you to be able to communicate across organizations to find local resources that you can send patients to. Providers are still heavily reliant on phone, fax, pagers to be able to expedite these transactions. And it really goes to illustrate one of the very, I would say, underreported areas of digital divide or lack of resources. And that's for healthcare workers. These processes are still very challenging to expedite. And so what we're trying to do at MyOwn is really trying to modernize that process. At MyOwn Communications, we've created a comprehensive provider-focused directory with a built-in integrated communication platform that hopefully makes that process much easier. We have a provider-rich directory that's synced to a national provider database that's continually updated with real-time information provided by our technology. We also have a ability to allow verified providers to upload additional content or information into their profiles to allow other providers to have additional visibility into what services they're able to provide. Ultimately, what you end up with is a consolidated, centralized resource that allows healthcare providers to, number one, find local and available resources. Two, find provider-specific content. If you look at the bottom left of your screen, you see Dr. Montgomery here, one of our pilot users, and has updated various practice notes and documents that help other healthcare workers navigate some of the bottlenecks that are commonly associated with referring patients to Dr. Montgomery. And finally, in the future, we've created the directory so that we can easily introduce a HIPAA-compliant messaging module that would allow you to then directly message providers such as Dr. Montgomery to expedite that process. So a little bit about our company. We started right here within the UNC entrepreneurship community, started in a class called Startup UNC, where we really took a back-of-the-napkin idea and just continued to grow it. Through the early part of 2020, we were enrolled and launched Chapel Hill. That really allowed us to grow as a business, incorporate, and allowed us to get involved with some grant opportunities and funding opportunities that allowed us to accelerate our growth and product development. This past fall, we had the opportunity to work with a bunch of pilot users up at the Advanced Medical Center in New Jersey, where we worked with them to really design and develop a directory that was best suited to their needs. And I'm happy to announce that just recently in February, we were able to formally roll that directory out and officially launched it. And now we're supporting about 60 individual providers that are using the directory and have access to the directory on a daily basis. Moving forward, 2021 is a super exciting time for us. We're working with our team to continually expand directory content and build product awareness. We're trying to get some of those pilot users actively engaged and registered for their individual profile accounts. We're working also with some of our development partners to integrate some of those HIPAA-compliant messaging modules. And moving forward, we hope to continue to work with a lot of the strategic partners in this room to help to fuel our growth. We're involved in some interesting conversations now with some state and government agencies about trying to create this nationalized directory and hoping that we can continue to leverage some of the resources that we have in the area to move us in that direction. And that concludes, I think, the very quick overview of our company. Hoping to see a lot more of you during the Q&A section, where we're hoping to be able to give you a live product demo and answer any additional questions about MyOwn and how we're working to improve the care delivery experience. Thank you guys so much.